We know that on the world scene, Australians are disproportionately successful in sport and in the arts and entertainment. But we should add to that list our international achievements in medical research. There's now an unprecedented expectation that medical science can cure us of all our ills and extend our lives. The West Australian Centre for Health and Ageing conducts research to help us extend our healthy lives. Professor Leon Flicker, you're the Centre's director. Tell us about the research focus.
The Centre's research focus is on translational research, moving fundamental discoveries into work on humans, and so that we can actually work out how to make people's lives better now. The Centre has three broad themes. The first one is healthy ageing, the idea of preventing disease in older people. The second theme is clinical research, how we can treat people better and how we can organise that their care is better, leading to our third theme of health services research, that we can more efficiently run health services to look after older people in Australia today.
Professor Osvaldo Almeida, you're the Centre's research director. Tell us about some of the work you're conducting.
One of the research projects that we have completed recently in the Centre was looking at ways of changing the memory decline that often happens with old age, particularly if it is what we call malignant memory decline, or decline that leads to dementia or Alzheimer's disease. So we selected a group of people who had mild memory complaints and memory problems, and we put them through an intervention of physical activity to see if that would change their memory outcomes over time, and we followed them up for 18 months. And what our research was able to demonstrate is by using a simple lifestyle intervention such as physical activity, we were able to improve the memory of these people who were randomized to receiving a physical activity intervention compared with normal people. So it's an outstanding result and has had a lot of interest worldwide and was published late last year in the Journal of the American Medical Association.
Depression is common among older people. Tell us about some of the progress that's being made in that area.
One study that we have conducted recently was to look at how genes might interact with the environment to contribute to people becoming depressed as they age. So we looked at a particular gene that is important in a metabolic pathway of something that we eat every day and produces a chemical in the body that we know causes harm if accumulated. And what we're able to demonstrate is that this particular gene seems to be linked to depression in later life. But the good news about it is there are lifestyle interventions such as simple diet and uses of certain factors such as vitamins that might be used to change those outcomes. And this is one of the things that we are doing now. We're actually running a trial to find out if by using those vitamins we can actually change and improve the outcomes of people who have depression in later life.
I urge you to support these researchers and assist them in helping find the key to extending healthy life.